All right, we finished up by talking about the hymen and how very, very, very poorly understood it is. We also talked about how the vagina was definitely non-keratinized stratified squamous epithelium, which is going to help prevent injuries and pain from friction, and also not be keratinized because that would be sloughing and that would be really gross. So the external genitalia are known as the vulva, and that is an important term for you to differentiate, because something like vulvitis versus vaginitis are very, very different conditions. Something like a sore on the vulva versus a sore within the vagina are different things as well. So you absolutely need to be able to differentiate between these things, even if the general cultural version of this says that it's all vagina. You can't do that as a medical practitioner. I have heard that various nurses and doctors still say vagina to refer to everything, and it's just colloquial. I recommend that you be better than that. That is my personal recommendation. So within the vulva, we have a number of structures. Let's zoom in here. There's the labia majora, labia minora. You'll see the external urethral opening. Let me get my laser pointer. I know you can't see that. So the external urethral opening is this small dot right here, just anterior to the vaginal orifice within the labia minora. So the glans clitoris is up here, and I will say kudos to your textbook for being up to date. It does have the most recent representation of the female erectile tissues. The full volume of the clitoris is encompassed on this image. So the clitoris does include the crus of the clitoris, and you can see that going along that pubic ramus right there. It's showing up on the recording. I know it doesn't show up on there. I'll do it again with the laser pointer. So the crus of the clitoris going along that pubic ramus, the bulb of the vestibule, and the greater vestibular gland. That bulb of the vestibule is erectile tissue as well. So the truth of the matter is, women have just as much proportional erectile tissue as men do. It's just embedded in the pelvic floor. So it's not quite as obvious. Another way to say that is we're just as big as they are. So again, here's the pointer. Here's the glands of the clitoris, which has historically been what textbooks actually show of the clitoris. There's the crus of the clitoris, that goes along that pubic ramus. There's the bulb of the vestibule and the greater vestibular gland, which does have a duct right to that entrance of the vaginal orifice. Now, why this is significant, we've known about male erectile tissue for very, very, very long time. In my first edition Grey's Anatomy that I have for funsies at home, we've got the male erectile bodies very, very clearly drawn. Guess when we discovered the full size of the clitoris as a scientific community? Not that long ago. More than 2 years. More than 4 years, it's getting up there. But 2009 is when we first published the full extent of the clitoris. We didn't discover the clitoris. Men didn't discover the clitoris till 2009. That's how hard it took for them to find it. That's what I say there. That's my thing. Okay. Boys, right? Part of that, I do understand that pelvic floor dissection is very boring, and it is hard to differentiate erectile tissue from muscular tissue in that region. It is very difficult. It's not really an excuse for waiting till 2009 to figure out that. So, good times, good times. One thing I will point out, I do have, here's our 3D thing. This is your three-dimensional representation of the clitoris, and I do want to show you that the glans clitoris is this externalized version over here. It does go back around to the proximal 1/3 of the vagina. In sexual health communities, there's actually been a pretty big debate about the size and extent of the clitoris and female pleasure. And it's actually been considered that women have better orgasms through clitoral stimulation, and that's absolutely true. About 2/3 of women have a very difficult or are unable to achieve orgasm through vaginal penetration alone. And it was actually debated for a while, can women even achieve orgasm through vaginal penetration? And the truth is yes, because the clitoris is back here as well. But it is more difficult to achieve orgasm than it is through clitoral stimulation. That's absolutely a fact. Direct clitoral to the glans clitoris. Okay, vestibule, urethral opening, vaginal orifice, know where your holes are at. labia minora. The mons pubis is superficial to that pubic symphysis that you know about already. And again, your textbook, even though it knows better, even though it has a great image showing that it's well over 2 centimeters, it still wants to tell you that the clitoris is a small less than 2 centimeters erectile body. Isn't that great, the way it contradicts itself like that? I should check the new edition, see if it still says that. Fingers crossed it doesn't, because they do have that picture right there showing it much larger than 2 centimeters. So, okay. If I sound angry about it, it's because I am. We could talk about some history of the clitoris anytime you guys want to. Moving on. Secondary sexual characteristics for women, mammary glands of the breasts. So they are glandular tissues. So these are compound acinar glands that do produce milk, and they produce milk into lactiferous ducts that empty into lactiferous sinuses, and they're held up via suspensory ligaments. So your breasts have suspensory ligaments as well. And in case we're not just getting enough shorthand today, shortchanged enough today, those suspensory ligaments are use it or lose it. So studies show that women who do not wear bras, on average, have nipples that are about an inch higher compared to women who do wear bras. So you're actually weakening your suspensory ligaments by wearing a bra on a regular basis, is the argument there. We're all going braless. Let's burn some bras tonight. Let's do this. Yeah, underwire is kind of the worst. For many reasons, too, but we won't get into it. It's open for debate if you are curious. I'm going to stop. All right, so use those suspensory ligaments whenever you can. Okay, we're good there. Moving on to the male pelvic region. Again, I'm going to remind you that most textbooks put the male pelvic region first because there's nothing offensive about a giant penis on the first page of your textbook chapter, but, you know, female reproductive anatomy on that first page, woof, no, not okay. So, here's our mid-sagittal section of the male pelvic region, and let's count some holes. Urethral orifice, anus. The end. Only 2. Men get 2. And notice how far apart they are. That's kind of fortunate for men. Actually, let's go back for just a second. There's a real health reason that I'm doing this, not just to be weird. I know. It'll come back in a second. I'm going, instead of showing you every single slide again, I'm going straight to it. So note how close by, that's the pen, there we go, laser pointer. The external urethral opening and the anus is on the female. This is why women have to be very careful, first of all, to wipe front to back. Not everybody knows that. Front to back. And then secondary to that, sexual intercourse can spread bacteria from the anal region very easily to the external urethral orifice. And we will talk next week about how urine is slightly acidic and it will help wash out bacteria. So this is why we have the recommendation that women urinate after sex. Some women will be more prone to UTIs than others. For example, a short urethra, a urethra that is more posteriorly located, or an anus that is closer to the external urethral opening. A lot of factors go into why some women are more prone than others to UTIs, but that is the logic. It is literally just the anatomy that causes that logic there. Let's go back to male anatomy. There we go. So note how far away that urethral opening is from the anus. Men really don't have to worry about that quite so much. And then they have a much longer urethra on the way back to the urinary bladder up here. So that makes life easier for them. Okay, mid-sagittal anatomy. We have the glands of the penis. We have erectile bodies from this view, including the corpus cavernosum and corpus spongiosum. There will be better views for that coming up. You can see the prostate gland, the bulbourethral gland, and the seminal vesicle from here. The ejaculatory duct, which is actually just this little bit right here, the ejaculatory duct is defined as the meeting of the seminal vesicle to the vas deferens. So up here's the vas deferens. Note that it hooks over that ureter. So next week we'll talk about the ureter, bringing urine from the kidneys down to the urinary bladder. So just take note of that position of that ductus deferens. So vas deferens and ductus deferens, same thing, synonym. We finish up our ductus deferens, we end up at the epididymis, which has a head, a body, and a tail, and that's going to be connected via a series of tubes to the testes. That testis is within the scrotum, which does have multiple layers. We will need to know a little bit about each of those layers. But I think otherwise that's about it for this cross-section. Questions about that? So again, primary sex organs are the testes. This is where spermatogenesis or spermiogenesis occur. And then accessory organs include pretty much the rest of it. I'm not joking when I say a series of tubes. I have noticed that that joke is aging out. Do you guys know what I'm referring to when I say series of tubes? No? I feel so old right now. So there's a guy who was in charge of the internet a while back who had no understanding of what the internet was, and he described the internet as a series of tubes. And the internet really loved that, and they just talked about how it was just always clogged with cats, just all the time. It was a fun meme day, but apparently nobody remembers it but me, so oh well. Okay, here's another fun bit. Back to the man bashing. In the anatomic position, the penis is assumed to be erect. Yeah, right? Because men, I don't know. My thought... Because they just want their penises constantly erect. I don't know. That sounds like it would be uncomfortable. He's a teenage boy, yeah. Probably. So we're just looking at a teenager who's got this going on involuntarily because of hormones. My thought is maybe like dog anatomy, where the penis is oriented in that direction on the sort of caudal surface, or the ventral surface rather. I don't know why we kept it for human anatomy. It's an interesting thought. But anyway, that's why the penis is erect in this picture, or at least facing in that direction. Part of what this is demonstrating, during embryological development, the testes actually form in the abdominal cavity, and then they descend. They descend through the inguinal canal here. So you have an inguinal ligament, and both in men and women do have a superficial and deep inguinal ring. Women our inguinal canal is pretty closed. Nothing goes through that in women. But in men, we do have, since those testes developed in the abdominal cavity, they took the nerves, arteries, and veins with them as they descended through the inguinal canal. So that superficial inguinal ring is important anatomy for you. You'll notice the nerves, arteries, and veins have specific names. In fact, that collective structure is known as the spermatic cord. Nerves, arteries, and veins plus the vas deferens, or ductus deferens, makes up the spermatic cord. That's an important vocab word. The pampiniform plexus is actually about this complex vasculature of veins, testicular artery, testicular nerve as well. You can also see some of the layers. As those testes descended through the abdominal wall, they actually took part of those abdominal obliques with them. They actually took external and internal abdominal oblique muscle with them to make up part of the scrotum. So externally you have this cremaster muscle, and that is going to be the one that caused the scrotum to become wrinkly in appearance. It's going to be partially about temperature regulation. And that is actually derived from, let's see if I can remember. I don't remember if it's external or internal abdominal obliques off the top of my head. What else can you see here? There's a raphe. There is actually a line there. It's just because embryologically these tissues came from the same things. The labia majora is the analogous tissue to the scrotal tissue. So those things formed separately and then joined along the midline. And that thing that looks like a seam on the testes, on the scrotum, that's called the raphe. There's also a dartus muscle. I believe that's more external, if I'm getting that right. And that's actually going to, make sure I actually get that right. I might have had it backwards. Dartos might be the one that makes it wrinkly, and cremaster may be the one that elevates it. Well, we'll find out. Okay. We do have these muscular features to moderate temperature. We do not want the scrotum to be the same temperature as the body core because spermatogenesis occurs most successfully about 3 degrees Celsius below body temperature. Okay, we did all that. We did inguinal canal. We did spermatic cord. So there are multiple layers to the testis, the tunica vaginalis, and there should be a tunica albuginea on the male system as well. So the tunica albuginea is white and adhered to the surface of the testis itself. Recognize that I'm using different terminology for the testis. This is the testis compared to the scrotum, which is the skin and musculature that holds testes. You did get to see this in your fetal pig. We had to open up the scrotum to get to those testes, right? There were multiple connective tissue layers. Did you guys get to appreciate those with the fetal pigs a little bit? So the pale surface of the testis itself is the tunica albuginea. Yeah, and then superficial to that would be the tunica vaginalis. Okay, also in this image, you'll notice these invaginations of the tunica albuginea make septa that divide the seminiferous tubules into lobules. So seminiferous tubules are the site of spermiogenesis. Formation of sperm happens within the seminiferous tubules, which again are divided into lobules, divided by septa, which is part of the tunica albuginea. After spermiogenesis, those newly developed but still immature sperm go here to the reedy testes, to the straight ductules, efferent ductules, and then they finish maturation in the epididymis. And again, that has a head, a body, and a tail. Then finally ejaculation will occur, and that will send sperm from the epididymis through the ductus deferens and along that whole pathway. Okay, where do we got? We're good on seminiferous tubules. Let's talk about some of the cells within seminiferous tubules. You do have sustentacular cells. I believe they're also known as nurse cells. You've seen nurse cells before in a different context. They support the development of sperm in this case. And they also help form a blood-testis barrier. Much like your brain, this region is sensitive to chemical changes. We don't want to suddenly dump a bunch of glucose onto these cells. That would be very irritating for them, or whatever else is in your bloodstream. In addition to large nurse cells, represented in green here, this whole thing here is a nurse cell, the purple, and then you have your dividing gametes over here. In addition to those, there are interstitial cells, cells that are outside of the seminiferous tubules, and those release testosterone. You'll note here they're also known as Leydig cells. There's a lot of extra terminology. I'll do my best to stick with the textbook terminology. The androgen they're referring to is testosterone. So interstitial cells release testosterone. You know testosterone comes from testes. Now you just have to add in the specific name of the cell that does that. We already covered oogenesis. And this process is going to be very similar. In fact, it's going to be simpler because we don't have a follicle around this. We just have to track the development of the sperm. Let's see, do I have a good one? I think this is probably going to be the best one. You start with a spermatogonium. This terminology is important for you. Spermatogonium is our diploid cell, 46 total chromosomes, 2 sets of 23. It undergoes a single mitotic division, just like the oocyte did, and at that point, we call it a mitosis and then primary spermatocyte. This is pretty much identical to the oocyte development at this stage. Then meiosis 1 occurs, and now we call it a secondary spermatocyte. It's still the same as female reproductive. Meiosis II occurs, now we call it a spermatid, and those further develop into just sperm, spermatozoa. So there is a difference between spermatogonium versus spermatocyte versus spermatid versus sperm or mature sperm. And again, we went from diploid to haploid. In fact, we got to haploid after meiosis I. Now, in this case, you do get 4 daughter cells out of this process. There's no polar bodies like there was in oocyte development. In my opinion, that's the toughest concept of today, is just the egg development and the sperm development and getting those fine-tuned terms down. All right, just like women, men have FSH and LH. The difference is that they don't have follicles, nor do they have luteal bodies. So, and again, we already learned this during our endocrine lecture. It's just coming back. Overall, FSH and LH is going to serve to increase spermatogenesis. If you want to be more specific about it, FSH most directly increases spermiogenesis, whereas LH increases testosterone, and testosterone does all kinds of things, including increasing spermiogenesis. So keep it simple if you want to. Say they just do spermiogenesis. There may be a case where you need to know about luteinizing hormone increasing testosterone. And again, just like with the female system, elevated FSH or LH will trigger the release of inhibin, which will decrease FSH and LH levels. Negative feedback loop, just like every hormone in every system. So we did this backwards before in the mid-sagittal section. Now we're going to go forward with it. Testes contain seminiferous tubules. Those seminiferous tubules will be the location of spermatocyte development. They will further mature in the epididymis, and ejaculation is going to take that sperm along the ductus deferens. It's going to meet up with the seminiferous tubules, the seminal vesicles rather, at the ejaculatory duct, which I have circled here. Here's the best image where you can really clearly see that the ejaculatory duct is just this small region right here that is the meeting of the ductus deferens and the seminiferous tubules. I'm going to zoom in on that area right there. So it's underlined and it's circled. You've got this little sort of V-shaped areas where those ducts meet up. The seminal vesicles will supply some fluids to the sperm content. So ejaculate is not just sperm. There are multiple fluids in them, including the product of your seminal vesicles, the prostate gland, and the bulbourethral gland. So know that ejaculatory fluid travels through this region. At this point, we call it the urethra. This is the prostatic urethra because it's the part of the urethra that is deep within the prostate. It's like a donut. It's going down the middle of that donut. As it goes through the pelvic diaphragm, the pelvic floor muscles, we then call it the membranous urethra. And as it goes through the corpus spongiosum, the most central erectile body in the male reproductive system, we call this spongy urethra. And then it goes into the external environment. So this, from here on, the urethra is a shared structure with the urinary system. You can see how here the ureter, the urinary bladder, and how that's all going to join up. And everything from urethra on out is a shared passageway that is also for urine, which is not true for the female system, right? Okay, any questions about that pathway? That all make sense? Did that. Head, body, tail, ductus deferens, ampulla, ejaculatory duct. Ejaculatory duct is very small, 1 to 2 centimeters long. There it is again. Again, prostatic urethra, membranous urethra, spongy urethra. 3 regions of urethra. I think your textbook has some fantastic images for differentiating these 3. Now those glands, the products of those glands are very important. First of all, seminal vesicles are going to secrete fructose and prostaglandins. Fructose is a kind of sugar. You may recall that sperm have a single flagella, and they have abundant mitochondria. They're going to have a long journey ahead, so you just basically packed them a nice little fruit lunch with the seminal vesicles. So fructose is like literally fruit sugar is what that means. And it's just a type of sugar that's going to be great for energy, and it's going to go, yeah, fruit sugar. Like high fructose corn syrup, same fructose. Yeah. Okay. Going back onto that, yeah, that's it. Fructose for energy, so that they can travel for a very long time through the female reproductive tract or a sock or whatever it happens to be. Prostaglandins stimulate vaginal peristalsis. So the vagina can clench and do things, and that's going to help a lot of things for sperm motility as well. Prostate gland, it's going to contain mucin, citric acid, which is also going to be a nice little lunch for sperm, seminal plasmin, which is going to be antibacterial, and here's a fun one, prostatic specific antigen, or PSA, an enzyme that helps liquefy semen. So there is actually stages of seminal fluid after it's ejaculated where it needs to be liquid for a time and then it needs to sort of solidify for a time. So that liquefied semen is actually pretty significant for humans' ability to reproduce. Bulbourethral gland is also going to, for our purposes, we're going to say it secretes mucin. So it's just mucus. And all of that together forms your seminal fluid, which combines sperm and we call that semen. That ejaculatory product is known as semen or ejaculate. And your textbook's pretty great. It says 200 to 500 million sperm. As I understood it from other sources, 500 million is the extreme high end. So the textbook's being a little bit egotistical again about male reproductive system. Which is fine. It's okay. You're allowed. Let's see, root bulb. Those ejaculatory bodies, we do have paired corpora cavernosa and a single corpus spongiosum, and that erectile body, much like the female clitoris, does extend along that pubic ramus. So men, it is okay to start measuring here. That is okay. That's acceptable. Now if you take a cross-section of those erectile bodies, to me they look like a little monkey face. Some people say it looks like a fly. That's fine. This is the paired corpora cavernosa, so corpus cavernosum, each with a deep central artery. And then the single spongiosum, corpus spongiosum. And that, again, has that spongy urethra going through it. That is what that detail is in the middle of that. Also significant are the dorsal arteries. Now remember, with the naming of the dorsal arteries, they are considered dorsal because the penis is considered constantly erect in the anatomic position. Okay, those erectile bodies and their dense vasculature, the spongy spaces do fill with blood. They are encapsulated by connective tissue, so there's no bleeding outside of that space. So parasympathetic innervation, generally we say, is what's causing the erection, and part of that is related to nitric oxide production. You know that endothelium can produce nitric oxide, which is a gas that causes vasodilation. Ejaculation is moderated by the sympathetic nervous system. Unfortunately, this is the old school understanding of this system, and I've mentioned during our autonomic lecture that we do rethink the pelvic outflow. We are assuming it is entirely sympathetic at this point, which is kind of unfortunate because the mnemonic device for this was awesome. We used to say point and shoot, point as in P for parasympathetic, shoot as an S for sympathetic, and that was really convenient, but now it's probably just all the sympathetic nervous system, which does explain why some men can ejaculate if they're running away from a bear. That's happened before. So, all right.
Wait, how would that
It's all sympathetic.
But the shooting part was already sympathetic?
The shooting part was already sympathetic. Yeah, no, it's not new information.
Okay.
That it's just, yeah, men can still achieve orgasm and ejaculate while absolutely afraid, which actually kind of feeds into our sexual assault lecture if we still want to have some degree of that today, even without our guest lecturer. Okay, any questions before I wrap this up? Yes? Breaking the penis. It means that you have injured the connective tissue layer that surrounds the erectile body. And that is going to cause bleeding into spaces that should not have blood in them. It makes a horrible popping sound. Any other questions? Can answer a lot of questions about this. Okay, that's